So next topic is cementum. So we discuss cementum under these headings: introduction, physical and chemical properties, cementogenesis, structure of cementum, type of cementum, cementodentinous junction, cemento-enamel junction, function of cementum, cementum anomalies, and clinical consideration. Cementum is a hard layer of calcified mesenchymal tissue which form outer covering of the anatomical root. It is also called as substantia osseosa. It was first microscopically demonstrated by two peoples of Purkinje in 1835. Cementum extends from the cemento-enamel junction to the apex of the tooth. The outer surface of cementum provides a medium for the attachment of the periodontal ligamental fiber that supports the tooth within the jaw. Cementum is the fourth tissue that forms the periodontium. Other tissue of the periodontium are the periodontal ligament, alveolar bone, and gingiva. The inner surface of cementum is firmly attached to the dentin. Human cementum is avascular and has no innervation. It has same physical and chemical structure properties which are same as that of surrounding alveolar bone. Cementum thickness varies in different teeth and in the same teeth in the different region. Cementum is thinnest as the cemento-enamel junction 20 to 50 mm and thickest toward the apex 150 to 200 mm. So this is the diagram which is showing the diagram of the tooth in which the outer layer of the root covered by the cementum and which is the thickest at the apex. Physical and chemical properties. Hardness and calcification of system even when it is fully mineralized are less than that of dentin. Cementum is light yellow in color, having a dull surface and a slighter darker hue. On become non-vital, it becomes darker. So percentage of organic material and inorganic material. In cementum, the percentage of organic material is 50 to 55% and percentage of mineral content is 45 to 50. In dentin, it is 30% organic material content inorganic content is 65.5. And dentin and bone is nearly similar, 30 to 35 in organic content and 60 to 65 in inorganic content. Cementum consists of organic matter, inorganic matter, and water. By volume, since cementum contains 35% organic material, 45% inorganic material, and 20% water. On a dry weight basis, cementum contains 45 to 50 inorganic substance, 50 to 55 organic materials, and water. The organic matter of cementum primarily consists of type 1 collagen fiber. Interfibular ground substance consists of proteoglycans, collagen type 3, collagen type 5, collagen type 6, and type 12 are also seen. The principal inorganic material in the form of hydroxyapatite crystal, which is less than that bone, enamel, and dentin. The fluoride content of cementum is highest in comparison with all other calcified tissue of the body. Cementogenesis. Cementum developed from activity of mesenchymal cells of dental follicle after fragmentation of the epithelial root sheath. After the formation of dentin, the loss of continuity occurs in the epithelial root sheath. This allows adjacent cells of the investing layer of the dental follicle to come lie on the surface of root dentin, and these are induced to differentiate into cementoblasts. These cementoblasts secrete collagen and components of the ground substance. So this is the diagram which is showing the process of the formation of cementum. Cementum formation started after the first layer of dentin of root is laid down. There formation of structureless, highly mineralized layer of about 10 micro thickness on the surface of root dentin. This is known as intermediate cementum. When the root dentin begins, the Hartwig epithelial root sheath that is continuous fragments and forms a network. This network enables mesenchymal cells to pass between the cells of root sheath. Now these come into opposition with newly formed root surface. These mesenchymal cells are known as cementoblast. Cementum is let down much slowly when the tooth is erupting. This cementum is known as acellular or primary cementum. Where tooth come in occlusion, more cementum forms around the apical third of the root, which has greater proportion of collagen. Cementoblast trapped in nuclei within the matrix, and this cementum is called cellular cementum. Cementum is let down in successive layer followed by apposition. This process is continuous and the thickness of cementum of root surface gradually and slowly increases with age. During cementogenesis, the cementoblast has interplasm organelles that are responsible for the and secretion of organic matrix. Most of the collagen in the primary cementum is derived from the Sharpie's fiber of the periodontal ligament. These are known as extrinsic fiber of cementum. The cementoblasts are responsible for producing cementum. When active, they are round plump cells with basophilic cytoplasm. These cells have well-formed Golgi apparatus, numerous mitochondria, and large amount of granular endoplasmic reticulum. During formation of cellular cementum, the cementoblast incorporated into the cemental matrix. These cells are known as cementocytes. These cementocytes have a sparse amount of cytoplasm, process numerous cell process or canaliculi. So this is the diagram of the cellular cementum, which is showing cementocytes with canaliculi, and these cementocytes are found in the lacunae. Structure of cementum. Under light microscope, two types of cementum are visible based on the presence or absence of cell. They are called acellular cementum and cellular cementum. There is no definite pattern of the distribution of two types of cementum. These may be arranged in alternate pattern. In classical pattern, acellular cementum predominant in the coronal half of the root and cellular cementum present in the apical half of the root. Acellular cementum is first form cementum and therefore referred to as primary cementum. It covers approximately by the cervical third or half of the root. So cementum is formed before tooth reaches the occlusal plane and thickness in ranges from 32 to 30 microns. It is thinnest at the cementoinguinal junction and thickest toward root apex. By its continuous growth, it contributes to the length of the root. They have principal loan in the supporting the tooth within the jaw. The cypress fiber are inserted at right angles to the root surface and deep penetrate into the cementum. They run at right angle to the corrosion fiber of cementum. The number, size, and distribution of sharp fiber increases with function of tooth. These fibers, which are derived from Sharpie's fiber, are called extrinsic fiber. It has lamellated structure like bone and show resting lines in the periods of inactivity. These resting lines or incremental lines are more calcified than the interlamellar cementum. These resting lines or incremental are present in both acellular and cellular cementum between the layer. Sharpie's fiber make up the most of the structure of acellular cementum. Cellular cementum is formed after teeth reaches the occlusal plane. It is more irregular and contains cells within the matrix called cementocytes. Cellular cementum is formed at faster rate than the acellular cementum. The apical third of root is usually covered by cellular cementum. The formation of cementum continues throughout the life. Usually it is cellular cementum which is continuously contribute to the length of the root. The intrinsic fiber arranged parallel to the root surface. The collagen fiber present in the cementum are both extrinsic fiber and intrinsic fiber. The calcified structure of acellular cementum consists of collagenous fiber and ground substance. Surface fiber also completely calcified in the acellular cementum. The inorganic mineral crystals are oriented parallel to the collagen fiber of cementum. Both acellular and cellular cementum are arranged in lamellae. These lamellae are separated by incremental lines which are parallel to the long axis of root. These incremental lines represent rest during the formation of cementum. These indicate periodic formation of cementum. These lines are more mineralized than the adjacent cementum. These incremental lines have less collagen and more ground substance than other portion of cementum. Types of cementum. Acellular, afibrillary cementum contain cells, not extrinsic cells or intrinsic collagen fiber. This type of cementum is product of cementoblast and is found as cervical cementum near the crown of tooth as spurs and patches over enamel and dentin along the cementoenamel junction. Its function is unknown. Acellular extrinsic fiber cementum. Acellular extrinsic fiber type of cementum is composed of densely packed bundle of Sharpie's fiber that are derived from the fiber periodontal ligament. It is found in the cervical and middle third of root, but sometimes it may extend further apically. The organic matrix of this type of cementum does not contain any types of cementum. This is the only type of cementum observed in the single rooted tooth. Next is cellular intrinsic fiber cementum. This is also called secondary cementum. It is situated at the middle to the apical third and furcation. Its function is adaptation. Cellular intrinsic fiber cementum have fibers derived almost entirely from the cementoblast. It is devoid of Sharpie's fiber. In humans, it fills resorption lacunae. So these are the pictorial diagram. This is the table which is showing different type of cementum. Now, next topic is cementodentinal junction. The cementodentinal junction is the interface between the dentin and cementum. The cementum is attached to the dentin firmly. Cementodentinal junction is sometimes scalloped in the deciduous tooth, smooth in permanent tooth. The collagen fiber of cementum and dentin are intertwined at their surface in a very complex manner. The proteoglycans are important for the attachment. It is not possible to determine which fibers are cemental in origin and which fibers are of dentinal. The cementodentinal junction contain large quantity of collagen associated with glycosaminoglycans like dermatan sulfate, chondroitin sulfate help in distribution of occlusal load to the alveolar bone. Area of dentin adjacent to Area of dentin adjacent to the cementodentinal junction appears granular in ground section, possibly due to the coalescing and looping of the terminal tubules of the dentinal tubules, and it is known as Tom granule layer. In decalcified and histological section, cementum stains more intensely than dentin. In some teeth, the dentin is separated from the cementum by a tissue called intermediate cementum. This intermediate cementum layer does not exhibit features either like dentin or cementum. This layer predominantly seen in the apical region of the posterior tooth and rarely seen in the deciduous or anterior tooth. It is believed that these layers is formed due to the entrapment of It is believed that this layer is formed due to the entrapment of cells of Hartwig epithelial sheath during the deposition of dentin or cementum matrix. The area of intermediate cementum can be found as continuous layer, or sometimes it is found only in isolated area characterized by wide irregular branching space. This layer appears structureless and known as hyaline layer. Next is cemento-enamel junction. The interface between cementum and enamel at the cervical region of the tooth is known as cemento-enamel junction. The relation between the enamel and cementum at the cervical region can be of three types. The cementum may overlap the cervical end of the enamel for the short distance. This type of cemento-enamel junction is seen in 60% type of teeth. This overlapping occurs due to this degeneration of the enamel epithelium at the cervical end. This allows the connected tissue to come into direct contact with the enamel surface and differentiate it into the cementoblast. In about 30% of the teeth, the cementum and enamel meet and as a sharp line, which is known as butt joint. In about 10% of all the teeth, the cementum and enamel fails to meet, and a small segment of dentin is exposed between the enamel and sensitive or may be covered by reduced enamel epithelium. This condition occurs due to delay in the separation of the enamel epithelium at the cervical portion of epithelium. In this case, the cemento-enamel junction is not formed. Now, the function of cementum. The most important function of the cementum is to provide attachment of the collagen fiber to the periodontal ligament. Cementum is harder than alveolar bone and has no blood supply, does not show resorption under masticatory or orthodontic fibers. Thus, during heavy orthodontic force, tooth integrity is maintained and alveolar bone being elastic in nature and change in shape, fulfilling the orthodontic requirement. Cementum has the property of continuous deposition and the patchwork of repairs for the damages such as fracture or resorption of the root surface. Regular cementum deposition of apex or help to replace the lost tooth height due to the occlusal wear or help in passive eruption of the tooth. Now the cemental anomalies. Hypercementosis is an abnormal thickening of the cementum. It may be diffuse or circumscribed. It may affect all the teeth of determination. It confined to a single tooth or even affect only part of the one tooth. It is localized hypertrophy, spur or prong-like extraction of cementum may be formed. This condition is frequently found in all teeth that are exposed to the great stress. These prong-like extension of cementum provide a large surface of area for attaching fiber. Thus, a fiber anchorage for the tooth to the surrounding alveolar bone is assured. These are the diagrams which is showing the part of the hypertrophic cementum. Localized hypercementosis may sometimes observed in the area in which the enamel drop have developed on the dentine. These hyperplastic cementum covering the enamel drops occasionally irregular and sometimes contain round bodies that may be calcified epithelial rest. The same type of embedded calcified round bodies found frequently in localized area of hyperplastic cementum. Such knob-like projection are designated as X-cementosis. They too develop around the degenerated epithelial rest. Now, generalized hypercematosis found in these conditions, which is Paget disease of bone, chronic periapical infection, non-functional teeth without any antagonist. Now, cemental hypertrophy. If cemental overgrowth improves or help in functioning of the teeth, this is referred to as cemental hypertrophy. Cemental spike generally develop from extensive occlusal forces or tensional orthodontic force. These provide a greater surface for the attachment of periodontal fiber. In localized hypertrophy, a spur or prong-like extraction of cementum may be formed. This is generally seen in teeth exposed to the great stress. Prong provide a large surface area for the attaching tooth. As a result, the firmer anchorage of tooth to the surrounding alveolar bone is formed. The difference between cemental hyperplasia and hypertrophy. Cemental hyperplasia, hypercementosis is also called as cemental hyperplasia when the cemental growth does not help in the increasing function of tooth and or it occurs in non-functioning tooth like cementohypertosis due to periapical infection. In non-functioning teeth, hyperplasia characterized by reduction in number of Sharpie's fiber embedded in the root. Now, next is the cementoma. Cementoma is also called benign cementoblastoma, cemental dysplasia. These are cemental mass situated apex of the root. They are included in the category of slowly growing odontogenic neoplasm and may cause expansion of the jaw. They are actually true neoplasm of the functional cementoblast. They more occur in female than male under the age of 25 years, and the mandibular first molar is the most common site of development. The surface of cementoma is lined by newly formed cementoid, which is lined by cementoblast and surrounded by connective tissue capsule. Cementicles are round laminated cemental bodies that are lie free periodontal ligament space or attached to the root surface. Cementicles develop around the central nidus, which may be a spicules or bone of cementum or calcified epithelial rest. Mostly they are found in aging person along the root. They may be found at the site of trauma. Repair and resorption of cementum. Cementum on the root surface undergo resorption repair alternately according to change in the environment faced by it. The resorption can be of various small degree that can be detected only microscopically, or it can be large quantity that can be detected radiographically. Local causes that cause resorption of cementum is TFO, cystic tumor, periapical pathology, excessive orthodontic force, embedded teeth, replanted and transplanted teeth. Systemic causes is deficiency of calcium, deficiency of vitamin A and D, and hypothyroidism. Cemental repair. There are two types of cemental repair. In anatomic repair, the root outline is re-established and it was before cemental resorption. It generally occurs when the degree of destruction is low. It establishes the cemental contour as before because only the thin layer of cellular and cellular cementum are deposited on the concavities created by cemental resorption. To maintain the width of periodontal, the adjacent alveolar bone grows and take the shape of defect following the root surface. This is done to improve the function of tooth. This is called functional repair. Histology and repair of cementum. The microscopic appearance of area show appearance of bee-like cavity on the root surface surrounded by large mononuclear macrophages. Period of repair and deposition of new and alternate period of reposition. This resorption is not a continuous reversal lines separated newly deposited cementum from the old cementum. It lines the border of resorption concavity. Periodontal fibers get attached to the newly laid cementum and maintain the functional relation. It is important to note that the presence of viable periodontal ligament necessary for cementum deposition, both vital and non-vital teeth can undergo cemental resorption. Aging of cementum. Smooth surface of cementum become rough due to calcification of small bundles of ligament fiber at the place of their attachment to cementum. In apical area, due to aging, continuous cementum deposition takes place, which may lead to closure of the apical foramen. Due to aging, cementum can also resorb for some time and deposition can take place for some time, creating reversal lines. Clinical consideration. First is ankylosis orthodontic tooth movement, extraction of teeth, fracture of root, importance of root planning in periodontal treatment. That's so we end with this topic of cementum.